Hello, everybody. Welcome to another episode of the Conception Channel podcast. This is a video podcast. I'm your host, Pentland, and today we're going to be talking about ways to optimize your chances of IVF success. So this is a bit of a longer video, and there's slides, obviously, to go along with it. So if you're listening on podcast, you can hop over to the YouTube channel, Conception Channel, to view the slideshow, but you can also just listen and get all the information that way. But it's going to be a little bit lengthy, as sometimes I can be long-winded anyway, but I want to make sure and convey all the information that I think is beneficial to anyone that's going through IVF, to optimize egg sperm, uterine lining and environment, and emotionally and spiritually, just to help get through the whole experience. So stay right to the end, or bookmark, or so you can come back and make sure you get or listen to the whole video. This is everything that we share with our patients and have refined over the years and found to really help. So hopefully there will be a ton of stuff in here for you today, as well as your husband or the sperm counterpart. And so let's get going. But before I do, I've been told to tell people more often to subscribe, please, to the channel. Like this video if you do, and hit the notification bell so you get notified whenever new videos pop up, because I'm re-uploading things that hopefully are relevant and will help you regularly here. So anyway, without further ado, first we're going to hop into a timeline. So from birth to menarche to 3 months prior to your IVF, which is quite possibly approximately where you're at right now, and then to IVF egg retrieval and transfer and beyond. But in a nutshell, a woman's born with all her eggs. For most women, ovulation and menstrual cycles begin around, the age of 10 to 14. If it's outside that range, there's, various reasons. In Chinese medicine, we have very specific reasons for that. But eggs, in general, though, remain dormant in a primordial state until they're chosen to wake up, mature, and ovulate. This maturation or antral follicle phase is a 3-month period in which egg health is influenced by its environment. So this is an important piece. So this is where we move into that 3 months prior to an IVF. So with respect to in vitro fertilization, this 3 months prior to the cycle, your body is already naturally choosing the group of eggs, to wake up, mature, and eventually ovulate, but in an IVF that will be matured with hormone injections and then retrieved for fertilization versus ovulation. So that in that 3-month period, the health of the woman during that time impacts the health of the eggs. I hope that makes sense. Because they wake and then grow, mature, and in that 3rd month, your body would have chose one egg to ovulate, but in an IVF, they'll grab that batch and stimulate and mature them and retrieve those. So your health in that time, important. So our treatment goals with an upcoming IVF, primarily with treatment, are to regulate emotions and reduce stress response, and to promote blood circulation to the reproductive organs to improve ovarian and uterine response to IVF medications, increase nutrient and oxygen delivery to eggs and uterine lining, optimize chances of pregnancy, help prevent miscarriage, and ultimately increase live birth rates. So promoting, optimal environment physically and mental emotional stress, which is a substantial part of the journey. So regardless of whatever plan is and recommendations are given today or to you by somebody else or yourself, self-prescribing through Dr. Google, it's important to choose options that are sustainable for you and those that you can realistically implement leading up to egg retrieval. And then those that can be added to support during the 2-week wait period and throughout your pregnancy. You don't want to move into what I call hyper wellness. Choosing too many things, overwhelming yourself, actually trying to get healthy but causing more stress by doing so is not the goal. So the first treatment that I recommend to anyone going through an IVF, if they, unless for some reason they know that acupuncture somehow isn't right for them, is getting regular acupuncture treatments. You know, it in that full 3 months, ideally. Before that, even more ideally, if there's conditions like PCOS or endometriosis or a severe male factor or something, so you've got time to work on that to improve it. But that 3 months for sure, ideally, and then at the very least, we like to recommend the 2 treatments per week in the 4 to 6 weeks leading up to that egg retrieval. So at least get that last pocket of time before the eggs are going to be retrieved in that 3 month that we were talking about. And then 2 treatments immediately before and after embryo transfer. Now that can be done at your acupuncture clinic. If that's a really nice, calm environment, that's probably best. Especially if you've got someone chauffeuring you, you don't want to be driving all over the city on your embryo transfer day. But if you've got someone driving you, just chill out, or on site at the IVF clinic if that is a service that's offered. After transfer, acupuncture treatments once a week are recommended till the end of the first trimester to ensure the pregnancy is stable, nausea is managed, your body is supported during the hormonal changes, and emotionally, just you're also feeling supported, because it's your journey isn't over yet then. And in an FET, or a frozen embryo transfer cycle, they've displayed a correlation to hypertension during pregnancy. So continuing acupuncture treatments is highly recommended once a week throughout pregnancy to help manage blood pressure and things like gestational diabetes and a lot of other conditions that can come up, because acupuncture, is one of the safe options that you can choose as part of the healthy management of a pregnancy. And there's another article, podcast video on the channel here called on IVF and acupuncture research. It combs through the systematic reviews and meta-analysis that show the efficacy of acupuncture on not just clinical pregnancy rates and live birth rates, but on the experience that women experience as well. So that's acupuncture. Moving on, supplements, vitamins, minerals, trace elements, herbs. These things are herbs we'll go through a little bit separately, but just traditional Chinese herbal medicine. But supplements are a rabbit hole that you can dig way down into, and ultimately probably find, almost any vitamin or supplement, how it could help, improve your fertility. But you want to be, ultimately you'd want to work with someone who can help dissect what's most important to you. But for the sake of a 30,000-foot view today, some of the essentials we'll just quickly ride through that I think almost everyone should be taking. And that one is a prenatal multivitamin that just provides basic nutritional support, and iron if need be. Iron is a highly absorbable preparation, especially if there's a iron deficiency. It's I think it's more imperative than people think. So iron is something that not only you could take, but there's ways that we'll go through that help improve iron absorption through diet, and that's probably even more important than just simply taking a supplement. Supplements for egg quality. We've developed one at Ian Still in our shop that you can buy online, or if you're a patient of ours, but it's called Quality. a suiting name, obviously, but just a custom blend of supplements that are specific for female reproductive health and egg quality. And these are, because we get them professionally compounded, we need to be always on top of the supplements that are being shown through research to be of most benefit. So it's a custom blend that shifts and changes with time, because we're always trying to deliver the best supplements necessary, and it's a lot of things put together into one at good dosages. So it's not you take a fair number of pills in a day, but it's instead of having a whole bunch of different supplements like N-acetylcysteine, vitamin C, and all these things, we've tried to put as much as we can into one bottle to keep it simple. And the other nicotinamide riboside, that should say increases NAD levels, which are involved in the maintenance and optimal function of many aspects of cellular DNA and mitochondrial health. Recent studies are showing improved egg quality, IVF response, and increased live birth rates, particularly in women of advanced maternal age. So particularly if you've had difficulties or unsuccessful IVFs before you're of advanced maternal age, consider nicotinamide riboside, or NR. It's a derivative of B3, vitamin B3. It's very safe, and to increase NAD levels is going to have a great impact on egg DNA health and mitochondrial health as well, which we know is important for cells to divide and energy, and youthfulness and health in the eggs. So inflammation, most people have inflammation, probably to a point where it's in excess and causing any plethora of concerns and conditions in the body, of ill health and disease. A lot of people would proclaim that inflammation may be at the root of most health disorders, but we want to address it. We don't want to always overdo it, but we want to address it, and not just from the supplement perspective, but this is a good place to start. We want to look at lifestyle, of course, as well. But vitamin D, almost an essential, especially if you're someone who has an ancestry that's used to more vitamin D than you're getting now. You've moved, in particular to Vancouver, where this is being recorded. Wet, dark winters, where you're not getting as much. Statistics, consistently giving feedback that most of North America is deficient in vitamin D, adults at least. It's essential for immune health, overall health, uterine lining as well. Another is omega-3 fish oils, high in EPA. This is an important piece. They regulate inflammation, they promote circulation, they deliver required fats for the proper production of sex hormones. Think about it, every cell is surrounded by a fatty acid layer. So if you're not supplying your body with high quality essential fatty acids like omega-3 fish oils, high in EPA, your cells may be suffering and more susceptible also to inflammation and oxidative stress, etc. So this is a place, don't compromise in quality, because you want to be eating or consuming good fish, ethically fished, and each batch needs to be tested for heavy metals, rancidity, etc. But very essential. And finally, probiotics. These can help bind and increase and excrete excess estrogens. So particularly important if there's ever been a miscarriage or a IVF cycle that has failed, because you're going to have high estrogen levels. But just overall for improving intestinal microbial balance and digestion, and stimulating gastrointestinal immunity, which is going to regulate inflammation again. So vitamin D, fish oils, and probiotics here are a good base for inflammation. The sperm, just quickly, we've developed a supplement called Abundance at Yinstill, similar to the quality one. You can find it in our shop, yinstill.com. But it's a custom formulation to optimize sperm quality, sexual function, things like libido, maybe even some impact on erectile function and testosterone as well. But it contains things like zinc and ashwagandha and magnesium ascorbate, so some vitamin C component there, carnitine, selenium, N-acetylcysteine, CoQ10, and uricoma, longjack. These are important nutritionals that have good evidence behind their impact on male sexual health and sperm quality. Okay, so that's supplements. Just a real basic overview of supplements. If you have other questions in that, leave them below. But we could go on forever just on supplements, and maybe I will do another video soon on top supplements, and we'll go a little deeper. But coaching next. Private one-on-one coaching sessions with a fertility coach, kind of like myself, to help you dig deeper, into your personal health and fertility needs and keep you accountable for doing what's necessary to accomplish your goals and dreams. You got to find an experienced fertility coach too. In these sessions, they're your opportunity to tap into their extensive experience and get individualized information. 1 or 2 of these a month, half hour is usually amazing to keep you on track and keep you moving forward, because times are hard, and often we know what we need to be doing. We just need to have support to help us persevere. So that's coaching. Thin uterine lining protocol. If you've ever, first of all, check out another video podcast slideshow called 16 Ways to Thicken a Thin Uterine Lining. That's also on the channel. It goes way more in depth into this, but for the sake of today, if you're within an IVF or you have taken Clomid in the past, or have had a DNC and maybe some possible Asherman syndrome has occurred that has maybe impacting your uterine lining thickness, consider some of these options, like citrulline, an amino acid from watermelons, 3 grams a day. It's oral administration, very tasteless powder. It's great, and it's even more effective to combine with IV and glutathione injections. IV of arginine. Arginine will help with blood circulation and improving lining, and glutathione. When citrulline and glutathione are done together, so glutathione is usually injected because orally it's difficult to absorb, but when they're done together, they effectively increase arginine levels even better than taking arginine. Or this is what the research that I've seen shows. Important, again, backtracking, but acupuncture, more accurately electroacupuncture, done at proper frequencies, is really essential. The wrong frequencies done with electroacupuncture can minimize blood circulation, so you want to get that right, or have someone that understands what they're doing. So if you actually have a thin uterine lining and you know that, and maybe the IVF is being stalled because of that, get in every day with your acupuncturist, 3 to 5 treatments a week even, because it's only going to be that once you need to do that. Castor oil packs, foot soaks, nightly. We've got more information on that on our website, and in the other video that I go more in depth into this. And basically anything you can do to rest, sleep, and experience joy. All these things shift the nervous system to its parasympathetic state. And when the body is in its parasympathetic state, or that feed and breed, it's when the body provides optimal resources to reproductive organs. It's really that simple. So blood will get to the uterine lining. All right, moving on to Chinese herbal medicine. Traditional Chinese herbal formulations are usually customized at least to some degree, specifically for you and your needs, to complement all the other things that you're doing, and you know, the patterns of disharmony that your life is displaying. In our case, and in the case of an IVF, they're typically indicated to soothe emotions, warm the body, improve blood circulation, build blood, regulate the menstrual cycle, and improve the environment in which the egg can thrive. You know, so there's lots of nutrition and circulation and warmth. So find someone who understands what they're doing with Chinese herbal medicine, and that is probably, out of all these, one of the more powerful options that you can choose. But the caveat here, at least the unwritten agreements we have with our clinics, is that we won't continue Chinese herbal medicine once you've started stimulation injections. We just don't understand interaction. But if you've gone through an IVF or two and they've been unsuccessful and you're just not having good response, this might be something your REI would be very open to, because we all have the same goal of doing our best and using our best tools to help you get pregnant and have a baby. So moving on to IV micronutrient therapy, so intravenous micronutrients like vitamins, minerals, amino acids. So the goal of IV in your specific case is to rejuvenate the eggs, mostly by providing antioxidants and nutrients required by the mitochondria, so the energy center of the cell, in particular the egg cell in this case. There's a close link between mitochondrial health and egg health, which we've touched on already, making it really important to support the mitochondria with antioxidants that help stimulate its energy production and overall health and protection, like N-acetylcysteine, vitamin C, magnesium, trace minerals, and so many others. But this is something that a properly qualified naturopathic doctor will administer, and why it's important that they understand the needs of a woman going through IVF and what the oocytes or the eggs are going to need most. So IV is the fastest and most effective way to deliver nutrients to cells and tissues in the body. So they provide 100% absorption versus 30 to 40% absorption through oral supplementation. So if you can and feel confident and want to add this to your lead up and prep for an IVF, it's a fantastic option. Adjunct to that, and already touched on, glutathione injections. We talked about it in the thin uterine lining piece, and it is often accompanying IVs more and more these days, because it's just so beneficial and so powerful. Glutathione's an antioxidant, maybe the master antioxidant of our body, that's important for health of each cell, including the eggs lining sperm tissues, or uterine lining tissues and sperm. It protects the cell and the mitochondria. It's kind of a detoxifier and a protector of oxidative stress, inflammation, and it also helps detoxify cells. So we know when glutathione's in sufficient quantity, sperm and egg health flourishes. We can see that in the research, particularly with sperm. So this is something also really beneficial for male factor, for the sperm. And on the contrary, obviously, when glutathiones are low, we see poor sperm quality and low fertilization rates. And again, it's not well absorbed orally, so it needs to be taken via IV or injection, subcutaneous or intravenous. I've got another video podcast slideshow on glutathione in particular, and it goes through the research for both men and women, which there is a substantial body on how glutathione improves fertility for both. So that's, if you want to learn more, there's a ton of information on that. Another injection that some people opt into is we call the MIC Plus injections. So MIC is methionine, inositol, and choline. We recommend them to any patient that's in need of stress reduction, increased energy, weight loss, improved digestion, and detoxification, particularly heavy metals and homocysteine. Depending on individual need, MIC injections, that's why we call them MIC Plus, will have the methionine, inositol, and choline, which help with methylation, which help with mood, which help with blood sugar, all kinds of benefits. But we may also include and customize and add B vitamins like B complex, B12, folate, amino acids like taurine and carnitine, and other micronutrients that might be of benefit, like minerals and antioxidants. So probably it's not always about something you need to add to your life, but often something you need to take away from your life. And so this next section, things to avoid, is particularly important. It may seem like it's not substantial, but particularly toxins in our environment can have, just little amounts can have huge impact on our hormones and our health. So a lot of the toxins in our environment are known to be estrogenic and disrupt reproductive hormonal balance, and can be are known major contributors to conditions like infertility and endometriosis, possibly PCOS, male factor, and obviously should be avoided during pregnancy. So why not start, beforehand? It makes sense. First of all, plastics like BPA, BPS, phthalates, plastics, the little number on the bottom in the triangle, plastics number 1, 3, and 6, and many of the 7 club, which is 7 is where they throw all the ones that are hard to classify. Phthalates are also in scented products, but plastic number 1 primarily, they're known to be anti-androgenic, so bad for testosterone, with transgenerational effects in animal models. So you take it, your children will have impact, their children will have an even greater impact. We're seeing this with chemicals like glyphosate and Roundup, and it gets worse through generations. It's everywhere. We don't even know how we used to live without plastics, and now they're used medically everywhere in our house, et cetera, et cetera. I mean, it's time to kind of take a step back on single-use plastics, at least as a first step. And hopefully most governments are wising up to that, because when we get to a point of wrapping our cucumbers in plastic, we should be reevaluating. Moving on to chemicals like pesticides, dioxins, artificial scents. Like if you read your ingredient list and it says anything about parfum or fragrance, personal care, cleaning products. I mean, the personal care industry is unregulated. So, I mean, there's great websites out there that can help you understand what's going on and what's in your personal care products. But if you don't do your due diligence, you'd never know. That industry is not looking out for you. Find companies that are and use their products. Otherwise, you could be disrupting your hormones. Because most people have no idea what they're rubbing on their face, their hair. What are you cleaning your genitals with every day of your life? Read the ingredients. If you don't understand what they are, look them up. There's a recent study in Nature by Nielsen et al. Nature is one of the largest scientific journals and most respected in the world. And this study was called The Assessment of Glyphosate-Induced Epigenetic Transgenerational Inheritance of Pathologies and Sperm Epimutations Generational Toxicology. In other words, what is Roundup doing to us from a transgenerational inheritance perspective? Our children, our children's children, our children's children's children. And the conclusions were that there's an increase in uterofetal deaths, polycystic ovaries, and a decrease in follicular count. All these things bad, obviously, and we all know enough that this will have a huge impact on fertility. This effect worsened in 2 successive generations. This was, I was talking about transgenerational, and it was also found to affect great-grandchildren, which made this a transgenerational effect. So even they even used third-generation males and bred them with non-exposed females, and similar outcomes were observed. So it kind of can come from either side and continue to be transgenerational. So, and remember, this is huge, and this is just reproductive outcomes. I mean, what else is going on in the world of cancer and diabetes and cardiovascular? Anyway, chemicals, important to avoid and understand better. Go organic. Organic food, I think we all know that it's important to lean into that, if not fully try to encompass that world and leave, industrialized, pesticide-laden farming practices in the past. Just one simple example, fungicides, so things that help reduce fungus on our foods, such as a drug or a fungicide, a spray called vinclozolin. It's used on grapes in the wines that we love, as well as other fruits and veggies common in our homes. And it's known to have anti-androgenic properties similar to finasteride or phthalates, like that plastic number 1. Or finasteride is an anti-androgenic drug used with men that have enlarged prostates. It's substantial, and this is on the grapes. Drink organic wine, and never. Grapes are one of the dirty dozen. Don't eat them unless they're organic. Just stop. How many of you out there drink non-organic wine or eat non-organic grapes? Drink out of plastic water bottles all the time, and use scented products. These are delivering these toxic chemicals to you and your eggs and reproductive system. Non-organic animal products. So just to drill down a little bit more, animal products, if there's one place to start with organic, it would be there, in my opinion. Wild meat and seafood always is best. Grass-fed and grass-finished also preferable if you're into agricultural livestock as far as a food source. I've seen so many people who are sensitive to dairy be able to tolerate it if it's grass-fed, organic, non-homogenized. The less human influence over it, the better. So go for non-organic animal meats. Also are often full of hormones and antibiotics and steroids to help them grow and be, less sick and bigger. Dairy and beef are also high in dioxins if they're not organic, particularly if they're near a source, like maybe pulp and paper mills, things like that. And this has been affiliated with endometriosis. Get free-range happy animals. I mean, that energy is going to translate into your body. If they've had a stress-free life, that energy is going to be in that food, and it's going to nurture you better. And always be grateful for the animal that you're eating. I mean, it's a big deal. And this is just, in my humble opinion, and it's something that I follow. I've always followed no veal or lamb. We're always trying to make babies, not eat them. Oils, moving on. Oils, something that's really important to understand. Industrially produced, oxidized, genetically modified organisms, high in omega-6, polyunsaturated fatty acids, aka vegetable oils like soy, canola, corn, sunflower. These things, if they're big and cheap, they're oxidized, they're industrially produced, so they're causing more harm, causing more inflammation than they're helping. You're not being healthier eating these and using these just because they're vegetable. Soy, canola, and corn, they're all genetically modified pretty much these days in those oils. Who knows exactly what that's doing to us? And these plants that are so vastly monocropped are just playing as much of a role in destroying our earth as any other ill-fated human practice. So use quality oils, stick to high quality avocado oils. Keep your cooking low, temperatures low so they don't oxidize. If there's smoke, it's too hot. This is a lot to unpack, but oils are, PUFAs, omega-6 are, these vegetable oils are as bad as sugar for us, if not worse. And moving on to artificial sweeteners, glucose fructose, or high fructose, and that's more in Canada, I think. High fructose corn syrup, more in the US. These are Monsanto monstrosities extracted from that genetically modified corn we were talking about. The oil goes to the oils, the sugar comes here. They're horrific for your system. In some respects, your body doesn't even understand how to handle it properly and metabolize it properly. And that's why it's so hard on insulin, and why diabetes and obesity is so rampant, partly due to these chemicals. Aspartame and all other chemical sweeteners as well, we want to look at and stay away from. They put stress on our liver. They make sweet cravings because they're so many times sweeter than cane sugar. They actually can increase the body's desire for more sweet. So you're not always going to be around them. So you're going to be diving into all kinds of sweet and sugar, and so they stress your liver. They can create insulin resistance and diabetes and just chemical toxicities. They're largely taken from GMO corn that also has had all kinds of pesticides sprayed on them. Things like atrazine. Atrazine's banned in many European countries due to the health impact, but not here. Politics, even too much of stevia, things like stevia, again, so sweet that they can actually help you crave more sweet. So be cautious with that as well. Just try and make sweet a treat. Cannabis. Almost every tissue involved in reproduction in both men and women have complete endocannabinoid systems, and exogenous cannabinoids like cannabis, marijuana, can interact with these receptors in the endocannabinoid system that are all over. They're on your fallopian tubes, on sperm, on, everywhere. So we're not going to get into that. I've got another podcast that dives through that, in the video podcast that is on the Conception channel or on the podcast channel. So dive in there if you want more information. It's a couple of years old now, but it's still quite relevant. When it became legal in Canada, we did some pretty deep dives. But to keep things simple, if you're having trouble getting pregnant and use cannabis, stop. Maybe it's impacting. If some might even say if you're having difficulty getting pregnant and you don't use cannabis, try a little bit. It might stimulate relations. That's a pleasant way of putting it. There's some epidemiological studies that came out of states that had legalized marijuana for a period of time, and fecundity rates actually rising. Who knows why? I mean, epidemiological research is just to kind of find information, not to really find causation. Analgesics, so painkillers, something else to avoid. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen or Advil. They have anti-androgenic effects again, so they can inhibit steroidogenesis, impact on testosterone, AMH levels they can impact, Leydig and Sertoli cell function, so production of sperm, ASA and acetaminophen, so aspirin, acetylsalicylic acid, or aspirin and acetaminophen, which more commonly known as Tylenol. and all its cousins. Long-term exposure to these has shown effect on germ cell proliferation by blocking RNA. So we want our cells to grow like an egg. So this decreased fertility and increased urine concentrations, or increased urine concentrations also showed an increased time to pregnancy. So all these should be avoided. And that's the end of the avoiding. I mean, again, rabbit holes could be dug for each, but we're going to move on into something very proactive, something that I feel like every successful person in the world eventually has included in their recipe for success is meditation. It's like exercise. There's many different ways that lead to different but similar ends. But the bottom line is regular practice is what's important and produces the desired effect. You know, I personally like to mix up my styles of meditation and techniques that I use. Everything from sitting and making sure I have just quiet staring out the window at tree time, to actual seated meditation, to guided imagery, to using my muse, to anyway, a 10 to 20 minute practice daily can do a lot for your stress levels, your performance, your nervous system, your heart rate variability, your blood circulation, and ultimately your fertility. Again, I've got another video podcast called Meditation for Fertility Optimization 101 on the Conception channel or on the podcast. Check that out. This one's also a video podcast, so it's got slides that you can follow along with or just listen to on the podcast. This will help you get started if you're intimidated, or if meditation's been tough. It'll kind of maybe put on a different pair of lenses for you to look at meditation through and get started with. So meditation, strongly encourage it. But maybe even more so, breathing. Moving on, daily breathing exercises are so vital. Breathing, period, obviously is vital to our health. One of the only things we can't live with. It's the only thing we can't live with for, basically any more than 5 minutes. But daily breathing exercises are so vital to all biological health and peak performance in anything we do. Oxygen is the primary fuel of all cells, and so this means sperm and eggs. We need oxygen, so let's give them a little extra. If it's our primary source for of fuel for our mitochondria to produce energy and youthfulness, I mean, we'll go out and take CoQ10, to try and increase our cellular ATP or our mitochondrial function, or but we could also just breathe, get more oxygen in as another way of fueling that. Ones I like, 4-7-8 breathing. It's super simple, easy to incorporate into daily life. Just do it a few times a day. You'll click into your parasympathetic side, and your reproductive system gets nourished. So all through your nose, breathe in for 4, hold for 7, out for 8. Do that a few times. Box breathing, similar, skipping over Wim Hof there. Another very simple technique, box breathing. Anytime you got a spare moment, you can fit it in like 4-7-8. I've personally seen this positively impact my own cardiovascular health. I love box breathing and 4-7-8. Box breathing is a technique also that, to my understanding, a lot of Navy SEALs use, snipers, these people that are in pretty high stress scenarios where they need to have simple techniques to lower their heart rate and recheck their nervous system. So box breathing is really simple. Breathe in for 4, all through your nose again. Hold for 4, out for 4, hold for 4, and just keep doing that. And finally, this Wim Hof method is something for the more adventurous out there to try. This will also introduce you to the importance of the regular practice of cold exposure. I think in this modern era where we are in comfort most of our lives, in buildings that are somewhere around 20 degrees, into a nice car, just not spending as much time in the elements. We've lost a lot of our ability to keep us warm. I very rarely meet women anymore that would claim to be warm enough, particularly hands and feet. So cold exposure is something, in men for sure. Heat, number one enemy of sperm. So check out the Wim Hof method. Moving on, sleep. Get enough quality sleep. This is very important to improve your fertility, maybe the most important. Even flies and insects sleep. It is essential. Okay, your aim should be to get at least 7.5 hours of uninterrupted sleep. Ideally 9. You know, it's the new performance enhancing drug in extreme athletes or elite athletes. But from a general and genetic health perspective, not honoring our circadian rhythms, you know, poor sleep and exposure to things like blue light, our screens, and before and during sleep can raise many people's chances of serious health conditions. We know this now, such as weight gain, hormonal imbalance, which really impacts our fertility here, cancer, Alzheimer's, just to name a few. You know, number one thing you can do if you've got Alzheimer's in your genes, ApoE4 alleles, sleep has to change. Cancer, weight gain, any of these, obesity, stress. We also know that reductions in REM sleep, predominantly in the second half of the night, makes us more emotional and foggy-minded. So getting enough sleep helps us deal with crazy times in life, maybe similar to going through an IVF. So get your sleep. And it's also vital that your partner or your husband, if they are in the picture there, get quality sleep as well, as it's documented that poor sleep negatively impacts testosterone levels and sperm quality. You know, poor sleep or sleep apnea has to be addressed. Quick recommendations, I can go way deeper into this. Sleep is tough. If poor sleep is a choice, change that today. Don't sacrifice sleep for productivity. That's crazy. Especially if you're trying to get pregnant. But if you're having trouble sleeping, some of these things may help, because it can be tough to kind of get on track when insomnia is in the picture. But first, observe. You know, use something like an Oura ring. Oura ring's probably the best for monitoring your sleep, but if people have Garmin watches, Apple watches, these things can also help. Find out what's going on, where you're deficient. Add some variables and keep checking. You know, see what helps, see what doesn't. Exercise, probably one of your best tools to help you sleep. If you're not sleeping well, nap. You're an adult now, so spoil yourself with a good bed, good pillow, good linens. I mean, you spend how much of your life, I forget, in bed. It should be a comfortable place for you. One of the most important things I counsel on and easiest to do is to try and get up and expose yourself to the early morning light when it's coming up, because that helps click our physiology and our neurochemicals into a cascade that will ultimately play a role in putting us back to sleep. So, and also connecting with the sunset when the sun goes down helps trigger things like melatonin, etc. Cool off your room. Heat is bad to sleep in. Have a bedtime routine that doesn't always maybe include Netflix or Amazon Prime or Apple TV, or browsing Instagram on your phone. Change that. You know, you're going through an IVF. Change these things for now. Get good sleeps. Don't keep your phone or other sources of electromagnetic radiation frequencies by your body. Darken your room. Get rid of all the light. Try and read before bed instead of those Netflix series. Try and reduce the noise that you'll be around. If you are a poor metabolizer of caffeine, you got to cut that out or down for sure, or stop by like 7, 8 in the morning so your body has time to metabolize it. You can also try things like sleeping on the ground, you know, or getting a grounding mat or different supplements that might help. I just wanted to go through this bedtime routine that we recommend to people just really quickly so you have an idea. You know, Turn off your phone or put it in airplane mode. Put on your favorite essential oils, rose, bergamot, these things that can help. Lavender help with sleep. A non-synthetic version of lavender, in case anyone's worried about that impacting your fertility or pregnancy. Administer the castor oil packs daily from cycle day 3 to ovulation. Soak your feet in hot water at the same time. And while you're doing that with your essential oil going and your phone off, start doing some of those breathing exercises, or turn on a guided relaxation like from John Kabat-Zinn or Circle and Bloom or Angie Online. These fertility meditations are fantastic. They help prep you for IVF. And finally, once you're done all that for maybe half an hour or 45 minutes, get out of the hot water foot soak, clean up from the castor oil, and choose one of these opening of the pelvis stretches and hold it. Do it in bed, hold it, and then just roll over and go to sleep. Like, change your bedtime routine, make it real healthy like this for the next pocket of time. Okay, so that's sleep, important. Another important is exercise. I think connection to earth and loved ones, breathing and water, probably top 3 most important things. Connection, water, air, and then exercise, diet, and sleep are the second tier. So here we are, sleep, pre-IVF. So in the months leading up to an IVF or a FET or ICSI or a donor cycle, we recommend a routine that to almost any woman, that's just a simple balanced approach to ensure aerobic, cardio, and strength training or resistance are all being addressed, as well as some flexibility is being maintained. It's a time where you can really emphasize stress in your life in that pre-IVF phase and go to town. Don't make it a huge stressor, but get lots of exercise in. Because when you're in your IVF cycle, you have to reduce, in some cases, basically eliminate once you're doing your stims, almost all aspects of physical exercise besides very, very light exercise and walking. It's also a great, probably the best way to, besides sleep, to minimize stress. Importantly, choose activities that are enjoyable so you can keep them consistent and sustainable. Exercise during IVF, like I just mentioned, during the medicated phase, we recommend that you really reduce your exercise intensity as well as the amount of time spent exercising. This isn't a time to push it, really, despite your instincts maybe and how it might help with stress. You gotta pull it back some. Your body needs to utilize the available resources to optimize its response to the IVF medications and to prepare your body for conception, not to be healing torn muscles and always in a recovery mode. So things like light aerobic or simply relaxing walking really is all that's allowed or needed. Stretches that involve trunk movement like twists and contractions also not recommended at this time as the ovaries are growing. They turn from an almond to a lime or approximately, and this can cause discomfort and actual problems. And then finally, post IVF, during your 2-week wait, you want to do lots of feet up, laying down. No heavy lifting. You want to be out of any stressful state because your body will naturally send more resources to nurturing implantation. No heavy lifting, housework, exercise, at least 3 days after your transfer. And then you start taking some slow, relaxing daily walks, getting fresh air. And this is how you should maintain physical activity until you see a heartbeat on ultrasound, in my opinion. And then once you've seen clear heartbeat and you're cleared at your ultrasound at week 8 of viability ultrasound, you can step things up, maybe 5-10%. Walk a little more at a normal pace, aerobically at the most. I see tons of women go through their first trimester and full pregnancies being completely healthy by just walking. It's not a time to be a hero, or prioritize exercise. Just kind of remember that any intense exercise of any sort takes away vital blood and nutrition, and delivers it to those muscles instead of giving it to baby. And once you reach your second trimester, you can breathe a little easier and begin to step back up if you really need to into an exercise schedule that more closely resembled the way it used to be for you, within reason. Always listen to that inner wisdom and consult, obviously, a healthcare professional that you're working with and your personal trainer before starting any exercise program during pregnancy. Okay, sleep, exercise, now diet. This is a big one, and I'll try and make it succinct and as individual as I can, or information rich as I can. So individualize first, cleanse. Depending on the timing, most people can benefit from a cleanse. But if you're right in the middle of an IVF, don't start cleansing. If you've got time beforehand, do an anti-inflammatory cleanse. Get your body reset. Feel clean. Get back on the clean eating diet or trend. Testing is also beneficial. Time or not, look for sensitivities, candida, parasites. Do nutrigenomic testing. If you've done your 23andMe, go a little further and or talk to me. I can help run your raw genetic data through health nutrigenomic profiling, so you can get some individualized blueprints of what you may or may not need. Look at cardiometabolic panels. Let's check out your cardiovascular health and your metabolic health, in particular, how your body's dealing with sugars. Maybe you need to really dial back on sugar and your insulin resistant, And then you can always layer traditional Chinese medicine dietary principles on top of all of those things. No matter how you're eating, it is a system that can be superimposed. And that would be, you'd have to talk to a qualified practitioner for that. I'm a believer that ancestry is extremely important. So stay close to home. Don't get too far off of how your family and ancestors have eaten for millennia. Your body probably isn't going to do as well, with huge changes. You come from, a Northern European family that has hunted and gathered for a long time, and then all of a sudden you are eating raw vegan diet. It's going to be tough, on your system. And whether it's due to ethics or whatever, I support that. But at a time when you're trying to conceive, it may not be as advantageous. So also eat according to condition. So if you've got endometriosis, obviously anti-inflammatory diets are extremely important. Avoiding xenoestrogens or phytoestrogens is also important. PCOS, again, inflammation, but more importantly, especially if there's obesity and insulin resistance, you have to eat according to that, reducing sugar. Weight loss, very similarly, and autoimmune conditions. Again, you want to find out what you're sensitive to, what people are commonly sensitive to. Eat an anti-inflammatory diet for the most part. Things like gluten, sugar, dairy could be impacting you extremely. So these things have to be addressed. Eat according to condition. Male factor, fertile foods. There's definitely some research on foods that are good for fertility for men, and nitric oxide in particular. I always counsel men to eat more nitrites and polyphenols. So nitric oxide, which is the foundation to Viagra, is Viagra's mechanism is enhanced naturally. So sexual function and just blood circulation is optimal. Blood vessel health. Eat anti-inflammatory diet as well can be beneficial. Sometimes in some men, intermittent fasting. I don't especially if weight loss is important. I don't recommend intermittent fasting to very many women unless they're quite overweight. It can be quite disruptive that'd be one time in life that it seems to be somewhat conclusive that women want to be weary of fasting is during reproductive times, because it can seemingly interfere with hormone balance. Important point during an IVF, if you're right in there, inside the cycle or very close, don't make any major shifts. This all depends on timing. All these other things we're talking about, if you've got time, great, make the shifts, because they're all going to be extremely beneficial, or do some of these things that are recommended. But if not, don't make any, choose your battles. Diet is huge. Start eating slowly a little bit better, because when you're pregnant, you're going to want to anyway. But bottom line, after all is said and done and talked about all these things, listen to your body. If you eat something and you feel like crap, it's your body telling you something. If you don't, or if you eat things and you feel well, raw diet, keto, whatever it might be, it doesn't matter. If you're not feeling well, and your body's telling you that, it's your best friend, you got to listen. So diet, condition specific, PCOS, we touched on this quickly. Insulin resistance and weight loss is important. Empty starchy carb reduction has to happen, slower carbs, better. Sourdough, legumes, nuts, low glycemic, you want to eat. Maybe some fasting or intermittent fasting could be appropriate. That's something you want to discuss with someone who's well versed in your specific needs. Or even what might be more beneficial is fasting mimicking, something Professor Walter Longo has popularized, and it's maybe a few days of caloric reduction each month or every couple months to get the benefits of caloric reduction without the negative side of caloric reduction, which would be a decrease in metabolism, which is why most people rebound with weight when they just are simply reducing calories. And then traditional Chinese medicine food cure for damp phlegm, it's called. That's something that has concepts that are very beneficial for moving forward with weight loss. Endometriosis, anti-inflammatory, because potential autoimmune component. Anti-estrogenic, anti-angiogenic, and antitoxin. So dioxins, like beef and dairy we talked about. Anti-angiogenic is something Dr. William Lee has done a great TED Talk in the past, which they're looking more deeply into, because endometriosis, like cancer, will create its own blood supply or angiogenesis. So minimizing its capability of doing that through diet is potential. And anti-estrogenic endometriosis lesions create their own, they have an autocrine function, it's called, that creates their own estrogen. So it becomes even more important, because that's what it needs to grow and kind of feed itself. So it becomes even more important to minimize exogenous sources of estrogen from diet or chemicals like we've talked about, and most importantly, again, anti-inflammatory, because endometriosis is a hugely inflammatory condition, and that can impact egg quality for sure. But diet, the bigger picture, look at how meals are prepared and eaten, and the sources of foods and the energy that's given to their nutrition in time in the kitchen, and how you can slow down and chew food, to increase absorption, proper ways to prepare food so you can increase absorption, the emotions that the animals or even the plants were, experiencing, emotions in plants, I don't know, but the environment the plants were around, how much of its anti-nutrients it needed to produce to ward off others, and how to properly prepare them so they're not bothering you, connecting with loved ones and your community and your spouse through food, and when you're sitting down, deepen your understanding of what proper nutrition is. This is huge. Look back into your ancestry. This is a huge tool for life, and something we've always done, and something we've really strayed away from the natural process in recent times. Since industrialization, we have stopped producing our own food largely, and that has disconnected us, and that's a problem. We need to reconnect with food because it's extremely important in our survival and thriving, which would be where fertility comes into play. And then you want to be a healthy parent, live long, and pass on good habits to your children. So some of these bigger picture things are maybe the more important reasons too, and things to look at when eating, instead of nitpicking too down deep at the nitty-gritty details. But related to diet is water. Bottom line, you want to stay hydrated and use clean water. Our body and our cells, our eggs, our sperm are 65 to 70% water. Hydration helps the body also manage sugars better. And you want to drink quality water, so not just any water. More and more water sources are contaminated these days, and people think drinking out of a plastic water bottle is better because it's cleaner, and it's not. Those could be just taken from a shitty source of water and then stored in plastic, which is leaching into the water. So quality water means reverse osmosis or distilled. Rainwater is distilled. Reverse osmosis is completely clean water. Both of these. And then you're going to want to add back quality trace minerals and elements. And finally, you want to filter your shower water as well. And this isn't perfect, but when chlorine heats up, it and is exposed to organic matter in the water source, like up in the watershed or wherever your water is coming from in your city. If there's organic matter or chlorine is introduced, something called trihalomethane is produced when it's heated. So in your shower, you're inhaling that, and this has been connected to miscarriage. So it'd be great to filter your shower and mostly minimize the heat and time that you're spending in the shower. All this could be unpacked a lot more again, but this is a nice quick overview. Moving on from water, disconnect and reconnect, I call it. We live in a mobile tech world. The metaverse is unfolding in front of us. So I think it becomes more and more important to leave all mobile tech devices at home and reconnect with the world around you on a regular basis. So if you haven't already done so, watch the documentary Social Dilemma. I don't know what viewing platform it's on, but Social Dilemma will kind of open your eyes to how the powers that be are trying to keep your eyes on their platforms and their devices, and you need to have more control over those mobile tech and streaming and digital addictions. Not to mention the electromagnetic frequencies or radiation that is being emitted by these devices. It's an important area of growing concern in the reproductive field. Microwave radiation, like cell phone, Wi-Fi, smart meters from your hydro, microwaves, have been shown to impact sperm and various other reproductive functions, including miscarriage, and also may impact pregnancy and the health of the offspring. We highly recommend minimizing exposure to microwave radiation when trying to conceive and get pregnant. Some countries even require women to wear protective clothing when they are pregnant to help minimize exposure to the baby. And bottom line, reconnect. You're reconnecting to Mother Nature and to your loved ones. When we set aside our devices or our vices and spend more time with Mother Nature and loved ones, our health improves, anxiety reduces, and we once again feel connected to what truly matters in life. So disconnect and reconnect. And this is a good segue into spirit. So what are things that you absolutely love but are no longer doing because you're just too busy? It's a question. So to me, simply here, dedicate time in nature. Her healing effects are unmatched. They bring more joy into your life, and commit to including time to doing things that nourish your spiritual side. Like these things, fulfill you. Spending time with friends that you feel good around. This is time when you can benefit from all the love and support that you're entitled to. Avoid people that are draining at this time. It's called a spiritual divorce. I recommended reading is a Debbie Ford book called Spiritual Divorce. And remember, it's okay to say no to baby showers or kids' birthday parties. It's fine. You got to avoid that stuff. Sometimes it's just a chapter. It doesn't always have to be this way. So dedicating time in nature, spending time with friends, avoiding things and people and time and activities that are draining. Practice feeling at ease in the moment. Take the opportunity to do this every day, at least once. The more you do it, the easier it'll be, and the more rewarding it'll be. It's important. You just be present. The now. If Eckhart Tolle would be a great author to dive into, to practice being in the moment. It's important not to lose yourself, particularly during these difficult times. Now's the time to dedicate to bring more joy into your life. Do things that you want to do. And that make you feel happy and joyful, and commit to including time to doing these things, and whatever nurtures your spiritual side. This has to be emphasized. So, what is it that you need to do? It's a simple question. Write it out, ponder it, and get some things on your task list that nourish you. Referrals, finally, too, we emphasize other therapies like sexual health and relationship counseling. They can be quite beneficial during these very difficult times. I'm a believer that pelvic floor physiotherapy may help relax very tense pelvic floor musculature that could be impacting the smooth muscle contraction of your uterus and the smooth flow of your fallopian tubes and vaginal muscles. And so seeing a pelvic floor physio might be beneficial, especially if there's any pain during sex or past trauma. Chiropractic can also help if you're not aligned in your spine. Your pelvis could be off, and your uterus could be sitting awkwardly inside your pelvis. I see that when I have patients laying on the table in front of me. It's easy to see if a pelvis is off, and I often recommend chiropractic. Life coaching, like we went through, is essential to just help you with career and everything else in life, because we're looking at this holistically, and it's not just an IVF you want to succeed at. You want to have a life that's fulfilling as well. And of course, massage. No one can. There's good and bad massages out there, but there's all kinds that you could experiment with. Visceral massage, Mayan abdominal massage, just massage therapy, just relaxing massages or foot massages or whatever. It's just more time in that parasympathetic state where your body's going to nourish your reproductive system. It's that simple. So with all of that, I congratulate you for making it to the end. I know there was a lot to cover, and I just breezed over the surface of so much of it, and we could go far more in depth, and there's all kinds of other videos and podcasts that are on the channel that I encourage you to flip back through this and find or look through and find if anything really resonated with you, or if you've got any questions, please leave them below, or find some way to contact me if you want to consult. I am around, drspencepentland.com. It's in the show notes. You can get a hold of me there and book a one-on-one so we can, really drill down into what you need to optimize your chances for IVF success. I wish you all the best and all the luck. Nothing is more important than family to me, and so I hope that you accomplish your dreams and goals. And until next time, I appreciate you being here, and good luck.